Knock knock. Mr. Brian Simpson.
Yeah, come in.
Hi Brian, how are you? My name is Camilo Gilaver. I am the treating physiotherapy today. How are you feeling?
I'm good. Yeah,
Are you
thank you.
cool? That's great, Brian. Um, just for safety precautions and so I can know that I'm with the right patient, can you please tell me your full name, date of birth, and age, please?
I'm Brian Simpson,
Mm-hmm.
and I'm 65 years old.
All right. I'm just gonna watch my hands while you tell me
Yeah.
everything here. Yeah, we're with the right patient, Brian, because this is an exam situation. You can see my two assessors here. He's X and Y, and they're going to stay here assessing me. Is that right for you?
Yeah, it's fine.
Not a problem?
No.
Do you mind if I have a seat here, close to you?
It's no problems.
Cool,
No problem.
thank you. Um, yeah, Brian, my session is gonna be probably 50, 45, 50 minutes. It's gonna split in three parts. First part is gonna be me asking you a few questions just to get to know you better, have an idea what happened like back in 2017 and how are you feeling now. Second part is gonna be me doing some hands-on assessment just to, have some outcome measures and see, how is your overall health. And then the third part is gonna be exercises. Is that right for you?
Yeah, it's fine.
Okay, not a problem. Brian, I got from your file, from your chart, that you have atherosclerosis. Is that correct?
Yeah.
And you are using simvastatin on a regular basis
Yeah.
and Panadol as well for probably your shoulder.
Sometimes, yeah.
Sometimes. Do you have any pain in any other side of the body?
No pain.
No pain. Cool. That's great. Brian, I also have from your files that back in 2017, that was 5 years ago, you have a right MCA stroke, meaning that one of those arteries was clogged with a thrombus. Is that correct?
Yeah.
You were at the hospital for 3 months, then you went back home, and yeah, I got also from the files that the left side of your body wasn't working quite well.
Yeah,
So,
that's correct. Yeah.
all right, how long did you had rehab since? Probably since until 2019. Is that correct?
I actually had the stroke 7 years ago.
All
Yeah,
right.
2017,
Yeah.
and then I,
Yeah,
I
7 years. Sorry.
yeah, no problems, and I had quite a lot of physio at the time,
Mm-hmm.
physiotherapy, but I cannot really say for how long. I don't really remember.
Mm-hmm.
Yeah,
Okay. And yeah, why did you stop doing physio? If you don't mind me asking.
like in terms of the physio, probably it's we reached a sort of a plateau,
All right. So you
and
were not finding any improvement.
oh well, like maybe slightly, but the most was done, and then like since I had to pay for it, I mean like it was. At some point we got to a point where it was enough, and
Mm.
I wanted to go on with my upper limb exercise for
Mm-hmm.
my arm, but they said that it was not gonna improve more than that.
All right. So you reached like a sort of plateau. So you ended up deciding no go ahead with the physio.
Yeah.
Okay. Okay, Brian. Just to make a bigger picture and get to know you better, do you have any other medical condition that I should be aware of?
Like what?
I don't know. Let's pretend or let's think about heart disease, any lung disease, bowel bladder disease, gastrointestinal disease,
No.
thyroid,
No.
thyroid problems.
No.
No?
No.
Okay. Are you taking any other medications apart from simvastatin and Panadol?
No.
Cool. Do you smoke?
No.
Do you have alcohol every now and then?
No. Very seldom.
Very seldom, meaning like just every now and then, very
Yeah, like
occasional.
it's very very
And
occasional.
if you don't mind me asking, Brian, how much are you drinking? How many cups each time you have
Maybe
a drink?
like a few sips of wine when we have to celebrate or
Ah,
something.
that's great. That's great. So keep that way, Brian. You're doing so well. The most important thing is keep you away from smoking, and but you are already doing so. That's great. Good on you. And the second thing is that alcohol is always advised to reduce it as much as you can, but having a sip of wine every now and then is perfectly fine.
Yeah.
All right.
Yeah.
Um, yes, Brian. I just want to confirm with you. You live with your wife. She is Johanna,
Yeah.
and she lives with you as well. And probably she is retired as well.
Yeah.
Is she retired? Are you working at the moment?
No, I'm not
No.
working.
You retired then.
Yeah, like after the stroke, I was starting doing some kind of different things at the job, and then
Yep.
at some points we decided with the company to retire. Yeah.
To retire yourself. And what sort of jobs did you used to do?
Um, I was working in a bank.
Like office work?
Yeah.
All right, fair enough. Brian, do you have any hobbies that you like to come back to?
Uh, like I used to go for walks with my daughter. Yeah.
How old is your daughter, if you don't mind me asking?
She's 38.
38. Oh, that's
Yeah.
great. And she doesn't live with you. She lives in her own place.
Yes. Yeah.
All right. Yeah. So hobbies probably would be, having a walk. Is there any other hobbies that you like to come back to?
Oh, well, not really that I can think. I mean, like
Mm,
I wanted to, to do these walks and to be more independent,
all right.
probably.
That's great, Brian. Um, Thinking at your house and your house setting, I know that the OT already assessed it when you just came out of the hospital. So, but I just want to make sure everything is all right at your house. These steps that are at the front and at the back, are you having any problems? Negotiating them, like going in and out of your house, going to the backyard.
No,
No problems at
no,
all.
no. I just do it slowly, but it's
And
alright.
inside the house, are you feeling confident walking back and forth, to your room, to the bathroom,
Yeah.
having showers, going to the toilet?
Yeah.
Is
Like,
everything alright?
okay. As I said, it's I got to take my time, and lately I felt like I was not being able to do things like before, just because I would feel a bit of, my legs were not supporting me as before.
Okay, fair enough, Ryan. We will go over that certainly. Um, let's focus now on why are you today here, Brian. I know that your doctor, Dr. Robertson, he's your neurologist, is it?
Yeah.
All right, he referred you because you have been having some frequent falls, and you already fell 2 times in the last 3 months. Is that
Yeah.
correct? And can you tell me, Ryan, what happened on those times? Were you feeling like wobbly? Were you feeling like lightheaded, or feeling any dizziness, or what happened on those times?
I wasn't feeling really wobbly or, or like, basically, I think I was walking and my legs didn't support me.
Both of them, or one more than the other?
I think it was the left one.
The left one was a little bit weaker, you reckon?
I think they both are getting weaker, but the time I fell, I think it was due to the left one.
Mm-hmm. Did did the left leg catch on the floor? Like, what 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 thing do you what do you think it led to the fall?
What do you mean, like a catch?
Like, let me try to explain you. When you were walking, probably you were walking when you had a fall.
Yeah.
So,
Yeah.
did you fall like the foot was caught on the floor,
Oh, no,
or it was more like The knee was giving way,
Yeah, maybe I was giving away.
giving way. All right.
Yeah,
So it's more related to like a sort of a weakness on your lower extremities, you
yeah,
reckon?
I think so. I really
Okay.
think so.
So you haven't experienced any lightheadedness, dizziness so far?
No,
No
no.
problems with your balance, like feeling like wobbly or feeling like you need to hold on onto the furniture or something.
Um, I think I can do pretty much anything. I just need to.
No spinning sensations.
No.
Great, Brian. Great. That's great. Um, I have a big picture of what could look like. I would like to do some hands-on assessment, but before that, Brian, I just want to rule out a few red flags that we could, we'll need probably further assessment. So, have you experienced like any sort of unremitting headaches or unremitting pain in any side of your body?
No.
No, like night sweats,
No.
chills, fevers.
No.
No, any chest pain,
No.
any problems with your bowel or bladder.
No.
No, any sudden weakness. Because you remember when this happened back in 2017 was something really sudden. Was all of a sudden.
Yeah.
Have you experienced something like that after that?
No.
No. And any pins and needles in the side of your body? Any numbness?
No.
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 That's right. That's right. As I said before, you don't have any thyroid problems, any lung problems, heart problems. No. All right. Fair enough. And just the last thing that I want to ask you, Brian. What are your long-term goals, or meaning, what are you expecting from the physiotherapy treatment sessions?
As I said, I would like to get back to do my walks.
Mm-hmm.
Yeah,
To do your works.
my walks.
Walks, walking. All right. So, um, yeah, Brian, and that's super good that you have that in mind. And what would be your short-term goals, or what are you expecting from just today's session?
Oh,
Could be a bit tricky to find out what you want to achieve today. It could be like a small goal, like I don't know, feeling less afraid of moving, or feeling I don't know less pain in the upper limb, or it could be um, I don't know, feel more confident walking.
yeah, that's probably the thing. Yeah,
That's probably the thing that's something that you want to achieve.
yeah.
You're not using any assistive device like any walking aid, like
No,
a walking frame or cane
no,
or crutches, are
no.
you? Cool, that's great. And is there anything that you want to add, Brian, for today's session? Anything that you comes to your mind that you want to achieve just today?
Um, no, maybe a bit more balance while walking. Yeah,
Okay, okay, fair enough. So certainly, Brian, we can work on that today. I will do my hands-on assessment, have a better picture of what's happening in terms of your balance, your strength, and your upper and lower limbs. And if there is anything else that you want to add on your history that you think it's relevant, like I don't know, anything that comes to your mind.
no,
No,
no.
not a problem. All right, Brian. Since you're sitting there, I'm going to start with my assessment. You don't have any issues with your sight or your vision, any blurred vision,
I,
color blindness
I, I don't see properly on my left eye. Yeah,
on your left eye.
yeah,
Okay, and that happened like after your stroke, was it?
yeah,
Did it improve a little bit since 2017 until nowadays, or is it getting worse, or is it basically the
no,
same?
it's the same.
Is the same. All right. Hearing problems?
I don't think so.
You don't think so? Is there any side of your body that you don't feel like 100%? Because your right side should be okay. That's gonna be our 100% of feeling sensation. Is your left side with any problems?
Yeah, maybe.
All right. We will find out. First thing we're going to go over vision problems. Sorry, my hands are so cold, so I just want to warm them up before touching you, alright?
Yeah.
So, I just want to make sure, Brian, sorry, I'm just gonna move this hat for you. Can you let me know when you start seeing my fingers, please?
Yes, it is one.
Cool.
So yeah, I keep seeing this one and maybe that one, like.
Is it a bit blurred or it comes like over
Yeah,
there?
Yeah, here.
Okay. Alright. One more time, just one more time. Let me know when you see the right and the left.
The right already, yeah, and I see the left.
Okay, cool, cool. Effectively, you have a reduced range of sight on the left side, so meaning that there is part of your left side that your brain is not getting the information from. So that's something that we can expect from our right NCA. All right. Just want to make sure up and down. Do let me know when you see my finger, please.
Yeah.
All right. And what about here?
Yeah.
Cool. Can you follow my finger with your eyes, but no head movements?
Yeah.
All right. Am I seeing any nystagmus or
No.
no? Any? All right. What about here? Follow my.
No.
Not a problem. Now, keep your eyes on my finger and move your head left and right, please. Cool. As far as you can, as far as you can.
Yeah.
Okay, left side one more time, please. And right side. Now up and down. Remember, keep your eyes on my finger. Alright, any problems that I'm seeing as scissors?
No.
No nystagmus. Correct. Okay, I was not expecting a nystagmus, but I was expecting this reduced
Okay.
vision on the left side.
Yeah.
In regards to hearing, do you hear the same, right and left?
Yeah.
Okay. I know that you are with a shirt now, so I just want to make sure you feel the same. This is your right side, and your right side should be your 100% of feeling or sensation. Does it feel the same here?
Not quite.
Not quite. And in terms of, let's put a number. If this is 100%, how much would you say is it on the left side?
Probably 60.
60. All right, almost a half. What about here?
Yeah. Yeah, same.
Same. So there is no difference between upper and lower part of your upper limb, which is perfectly normal. I'm gonna go with the lower limbs. This is gonna be your 100%. Okay. What about here?
A bit better than the upper one.
Mm-hmm.
So, but yes, still the difference.
And what number would you say between? This is your 100. How much would you say this is?
Maybe 70.
70. All right. And what about here?
Yeah, probably the same.
Same here.
Yeah.
Okay. And what about here in the sole of your foot?
Yeah.
Cool.
The same.
All right. I want to make sure you. I want to assess your proprioception. So, if you close your eyes, please.
Yeah.
Can you let me know if your finger is up and down or down?
Okay. It's up. It's up. It's down. It's up.
All right. There is a reduced proprioception on your left side, which is something that I was expecting. This is pretty normal. We're going to do the same with the left. Sorry, with the left one. So close your eyes, and you are going to let me know. It's a bit tight. Oh, sorry for that.
Yeah.
So, what about here?
Um,
Up and down.
Up. It's up again. It's down. Oh, maybe, I don't know, maybe up. I'm
Okay, that's all right, Brian. This is something that I was expecting to find because you know the right side of your brain controls the left side of your body,
Yeah.
and because there was an injury back in 2017, I'm expecting your left side to be weaker, to be with less sensitivity, and obviously the proprioception, which is the sense of the joint, you know, the sense of the joint in the space. I'm expecting to be also reduced.
Okay.
All right, so this is something normal, not normal. This is something expected after your stroke. Okay, we certainly will keep this in mind. All right. Can you please, with your with your left upper limb, can you touch my hand, my finger, sorry, and then go back to your nose as fast as you can? Okay. Fair enough. Can you do it with your right arm, please? As fastest as you can. This is the fastest that you can go?
I don't want to go any faster than that, mate.
You don't want?
No, it's
All right. It's because there is any problem with that?
No, not this one, no.
Mm-hmm. And why do you want to go faster? Is there any problems that?
No.
Huh? Okay. Okay. With your right leg, you're going to do what I call a heel shin test, which is trying to roll or brush your left shin with the right heel. Okay? So try to do it with your right, please.
Yeah.
Yep.
Like that.
Yep. 2 times, please. Fair enough. And now with the left, please, can you do the same? Okay. That's okay. That's also normal. Expected after a stroke. Can you please do this for me? Raise your arms both up. All right. This is the further you can go.
Yeah.
What about forward? Okay. Since I'm not expecting any problem with your right side, I'm going to focus on your left upper extremity. All right.
Okay.
So I'm just going to move your arm, and you can let me know if there's any pain. All right. Let me know if there is any pain on your shoulder. No?
No.
Okay. What about here? No problems at all?
No.
Alright, there is no restriction in the movement, so meaning that probably your glenohumeral joint and your elbow joint are working fine in terms of joint motion. Can you do chicken wings for me, please? Like so? Okay. Has the OT been working with you on the left upper limb or
Yeah, we've been working in the past. Yeah.
in the past, but not since 2019 in average? All right. And all right. What about the elbow? Can you please bend your elbow up for me? Flex, flexion. All right. And then do an extension, please. Pull my, sorry. Yeah. One more time, please. Can you squeeze my hand? Squeeze as hard as you can. Can you squeeze my hand, please? All right. Fair enough. There is some weakness on the upper extremity, left upper extremity. We're going to do the same with your hip. Can you please bend your hip up for me, please? Flex your hip up, and then the right one. Can you do the same for me, please? All right. Extend your right knee, please. Just knee extension, and while you're doing knee extension, can you do flexion and extension of your ankle, please? With the knee extension, please. Now you do a up and down. Any problems with that? Any radiating pain?
No.
We're going to do the same with the left one, okay? So try to extend your knee, please. One more time. Okay. And while you are there, can you please Go up and down with your foot. Flexion and extension, please. Alright. Alright. That's okay. I just want to make sure we have the full range of motion.
There's the chair just below.
That's alright. Sorry about it. Sorry for that. Sorry. No radiating pain when I extend your knee here.
No.
No pins and needles in the back of your leg. Okay. Same as here. No problems at all.
No.
No. Okay. Okay. Let's do some manual muscle testing. Can you please go up with your knee, please? This is the higher you can go?
Yeah, like you're pressing too much.
Alright. Can you try to do it again? Alright. Fair enough. And we're going to do knee extension, please. Alright. What about here? Press my hand. Okay. What about here? Press my hand. Good job. What about the left one? Can you please raise your knee up, 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 up? Pretty good. One more time, please. Okay. Can you please extend your knee for me, please? Up, 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 up. Okay. What about the ankle now? Can you please go up? Press my fingers up and down. All right. What I found here, Brian, is that both lower extremities are weak. The left one is weaker than the right one, which is again is something that I am expecting after a stroke. All right. We will certainly work on that. There is reduced proprioception. The coordination is a little bit impaired. It's not too bad, but it's also because probably the inputs from your, the joints and the muscles and the skin is not getting properly to the right side of your brain. But that's fine. We will work on that. Can you show me how do you stand up from the chair or the plinth where you are sitting now, please? Okay, can you go back please for me?
What do you mean?
Have a seat. Alright, because this is my first time with you, I'm just gonna quickly go and grab my Pelican belt because I'm seeing that you are a little bit wobbly. So, yeah, let's pretend that I already got my Pelican belt. I'm gonna put my Pelican belt here, and we're gonna have my accessors on your left side, which is your hemiplegic side. And he's going to be just of safety precaution for me, okay? He's going to be aware that you don't fall over that side, okay? So, now that you're with your Pelican belt, I'm gonna have a seat in my chair, and I want you to stand up again, please. And I'm gonna hold you from the Pelican belt. Okay, and my assessor is going to help you with the left side. Okay. Brian, if you don't mind me asking, how did you get to, the clinic? Just by yourself? Were you walking by yourself?
Being brought here by my daughter.
Mm-hmm.
Car, yeah.
Did she let you like in the parking area and you came inside walking?
She came in with me.
Mm-hmm.
And then I came inside walking from the hall to here.
From the hall to here. Okay. I'm not seeing any problems with your loading. Yep. Not problems with your loading, meaning that you are putting same weight basically on the left and the right side. I'm not seeing any problem with that. Can you please look forward for me? Just stay as straight as you can. Any feeling of dizziness, lighthead? No? Okay. can you please point with your feet straight forward? Because your feet are looking outwards. Can you please make them look? Okay, fair enough. Can you please now load weight on your right side and on your left side? Weight shifting. Alright, can you do some marches on the spot for me? Like so. Okay, that's alright. Stay there. Keep your feet apart, like probably 30 centimeters. Look forward. And I'm gonna have a look. Sorry, take the time that it takes to you to hold this position by yourself, alright? Look forward, try to keep there. There is no balance issue, there is no sway, IP or lateral sway, so that's great. 20 seconds, done. You are going to do the same with your eyes closed. Please close your eyes. Close your eyes and try to keep that position. Alright, minimal sway, probably AP and lateral, which is not too bad. But you're still able to do it 20 seconds.
Yeah.
Are you feeling dizzy or
No.
any spinning sensation?
No.
Alright, now you're going to keep your feet together, please. Put your feet together, like both ankles together. Eyes open, and you're going to keep that position, okay? Cool. That's great. Let's say you already did it 20 seconds. Now the same thing, eyes closed. Keep your eyes closed and keep that position, please. Alright. A little bit more of sway AP, but that's not too bad. Okay. Easy. Open your eyes. How are you feeling?
Yeah, it's
You
alright.
feeling okay?
Yeah.
Alright. We are going to do something that is called 30 seconds rise and sit test. It's the same that you told me yesterday. Remember?
The time test.
No, it's not the tuck test. This is called the 30.
The 5 times sit-up test.
Oh, yeah.
Okay.
Alright, so what I want you to do, Brian, is that I'm going to time how, not time, in 30 seconds I want you to stand up and sit down as many times as you can.
Okay.
Alright?
Okay.
And you are going to tell me how exerted are you feeling, how much fatigue. Alright? There is a scale that we call rate of perceived exertion that ranges from 0 to 10, meaning 0 there is no exertion, no fatigue, and 10 is extreme fatigue, meaning that you cannot give one more step. Do you understand that?
Yeah.
Alright, so let's say that 0 is when you are not doing any exercise, and 10 is like the worst case scenario. Alright? What number are you going to give it to the exertion or fatigue now that you are sitting there?
Maybe 1.
Oh, 1?
Yeah.
Beautiful. Alright, so as soon as you finish these 30 seconds, I want you to tell me the number that you are feeling of fatigue as well. Alright, and I'm going to count how many up and down you can do. Okay?
Okay.
Alright, 1, 2, 3.
Go.
Go. Up and down. Remember, this is as many times as you can. Okay. That's it. You already did 3. That's 30 seconds. That's one of the outcome measures that we are going to keep in mind for probably 2 weeks time and reassess to see how are you going. All right? And what is your number of fatigue now from 0 to 10?
Oh, maybe a 4.
A 4?
Like,
Not too bad. Not too bad. That's good. I just caught a few things that I want to work with you while you are sitting here. Each time that you are standing up, you are putting lots of weight on your left side, so meaning that you are standing like so. And I want you to start working on your standing up technique. All right? Let me just make this thing clear. I want you to know your nose to be like a little bit ahead or forward in relation to your ankles. So you can rock up 1 or 2 times. 1, 2, and when you say 2, your nose is a little bit forward in terms of your ankles, and then you are going to stand up, putting equal weight on your right and your left side. Does it make sense?
Okay.
Do you understand what I am telling you?
Yeah, okay.
All right, because this is what you are doing now, and I want you to start putting equal weight on the left and the right side. Okay? Like so.
Okay.
Now that you have your handles there, I know your left hand is not too strong, but try to do as much as you can, and maybe with the right one you can hold on the armchair, and then rise your weight from there.
Okay.
Help you with the right armchair. All right?
Okay.
Can you do that for me now?
So you want me to
Stand up and try to put the technique that I already told you. Rock you back and forth. 1, 2.
like that?
Wow, that was a really good improvement, Brian. Can you stand back for me, please? Go back and. All right. Sorry, it was my bad. Can you please stand up again? Sorry for that, Brian. And now that you are sitting back to the chair, remember to do like so. Go back until you feel the chair back in the back of your knee. Go back, 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 back. Now you can feel the chair in the back of your knee. Yeah. Now you're going to hold onto the armchair and then go down slowly. All right? Feel the armchair. Cool, much better. Did it feel better?
Yeah.
A little bit?
Yeah.
All right. How do you feel to go for a walk now?
Oh, I'm alright.
Are you okay?
Yeah.
All right. So stand up. Remember the technique that I already told you. Rock you back and forth 2 times. Nose forward in relation to your ankles, and then stand you up, putting equal weights. All right. That's much better. Yeah. Are you feeling okay?
Yeah.
All right. This is what we are going to do. I want you to do, what is it called, a 10-meter walk test.
Yep.
This is gonna happen in the gym area.
Yep.
You're gonna be sitting on the chair, and as soon as I tell you go, you're gonna stand up from there, walk 10 meters, and that's it. Have a seat on the other chair that I have in the end of the gym area. Did you understand that?
Yeah.
Is that clear?
Yeah.
Cool. Now I want you to come and have a walk for me, please, and I'm going to. Okay. Just come here, and we are going to the gym area. All right, this is a chair.
Okay.
Have a seat there. All right, and there is the 10-meter mark. I want you to stand up, walk as fast as you can, and have a seat in the other end of the 10-meter. Is that clear?
Yeah.
All right. And I'm going to time how much it takes you to go that way. All right. So 1, 2, 3, go.
Okay.
Stand up from there. Just gonna hold on your pelican belt. Okay. Come on, don't go away, Brian. Great. Great, Brian. Have a seat, please. All right. I catch a few gait impairments on your gait, meaning that your left foot is not doing a proper toe lift. You're having some difficulties clearing your toes, and that's probably what it's causing. What I already asked you before, maybe it was not understood, but you're dragging a little bit your foot on the left side, and that's something that could add up on the fact of a fall. You know what I mean?
Yeah.
So because you're dragging the foot, maybe it could catch and you can fall forward. So probably that's something that we need to work on.
Okay.
All right. So first thing that I want you to do now, we're going to the parallel bar. Come here with me, please.
Yep.
Yep. Hold on into the parallel bars. I know you're feeling freezing here, but stay there. And we are going to start working on your gait pattern, especially on your left side. All right. So while you are holding on your left on the parallel bar, I want you to do like a horse step. It's called like a horse step, like being really exaggerated, trying to flex the knee, trying to bend the knee. Sorry, flex the hip, bend the knee, and try to keep always the your foot or your feet, sorry, up.
Okay.
Are you understanding me?
Yeah.
All right. So what does it mean? Keep the feet as much as upright as you can. Does it make sense?
Okay.
Are you understanding me? Because my language is not sometimes is not very clear, so I just want to make sure you understand me.
Yeah. Okay.
Yeah. All right. Fair enough. Start working on that pattern. Hip flexion, knee flexion, and try to keep the point of your toes up. All right. And you're going to do heel contact, and then you're going to go back. Yep. Try to don't step on the feet. Just stop before of that.
Yeah.
All right. So stop there and then come back. All right. Great. Remember, don't wait there on your. I know this is difficult, but I want you to keep in mind this. Try to don't step on your feet. Great. That's okay. This is something that we are going to work on. Okay. We're going to do this 10 times. And I want you to remember this exercise because this is something that we are going to do at home. This is going to be part of your exercise program. All right?
Okay.
One more time. Remember, 10 times. Try to stay there and go back. There and go back. That's much better. That's much better. Much better. All right. Okay, now that you are standing there, I want you to start doing this exercise that is called, like, it's going to work on your proprioception, your balance, and your strengthening of your lower limbs, all right?
Yeah.
So try to stay there 10 seconds with the right one, then 10 seconds with the left. Okay. Beautiful. Now go with the left. If you need to hold on the parallel, that's fine.
Yeah.
Beautiful. One more time with the right. And one more time with the left. All right. Look, Brian, what I want you to do at home is the first exercise that we do. You can hold on to 2 chairs if you need to, and then do this exercise. But be exaggerated. Be exaggerated with the hip flexion. Keep the knee flexion, and remember, pointing up. Your toes will be pointing up. Heel contact and stop before hitting the floor with the toes. Stop before and come back. Alright, 10 times with the left. We're going to do 10 times with the right. And then we are going to do standing on one leg 10 seconds with the right, 10 seconds with the left. Is it clear? Questions about it?
No.
Is it clear for you?
Yeah.
Are you feeling right?
Yeah.
Feeling just the cough? No? Okay, good. Those two exercises I want you to do at home and try to keep you walking as much as you can. Probably, I don't know, 10 minutes a day. How does it sound for you? Are you able to do that at home?
Yeah, okay.
Are you able to do 10 minutes walking?
Maybe. Yeah.
Maybe? Alright. If you can't get to the 10 minutes, maybe you can get to the 5 minutes and that's fine. But we could start working on that. Alright? What I want you to do at home, and each time that you are walking, try to remember to keep your toe up. At the beginning it's going to be a bit hard because your lower limb is a little bit weak. That's fine, we are going to work on that. But remember to keep your feet up, try to do proper heel contact, try to put in practice what we have been working today. Heel contact and then step through. Alright, heel contact, step through. Okay? Does it make sense?
Yeah.
Let's try to do one more walking back and forth on the parallel bar. If you can not hold on the parallel bar, that will be great. But if you need to hold on, the parallel bar is going to be there for you. Okay? Try to put in practice what we have learned today. Heel contact, step through, then heel contact. Remember, toe up. Okay? Go. That's a much better pattern. Alright. Now turn around. And the same. Remember, heel contact, try to keep your feet up. Does it feel better?
Yeah, kind of.
Are you feeling like a little bit better? Because
Yeah.
one of your goals was to feel more confident walking.
Yeah.
Does it feel better now?
Yeah, a little bit.
Alright. We're going to step out of the parallel bar and I want you to walk the same 10-meter walk back and forth. But remember, heel contact, step through, heel contact, step through. Make sense? Alright, well, I'm not gonna time now. I just want you to walk back and forth and see if there is any improvement with that. So you can have a seat now if you need. Alright. And go for it. I'm gonna be standing just next to you. Alright, keep in mind what we have learned today.
Yeah.
Remember, do a proper heel contact, trying to keep the feet up, your feet up.
Yeah.
Okay? So that's gonna add up on the fact that you are falling. Alright? We can go back to the room, yes. And we are going to start wrapping things up. Alright, summarizing Brian today, what we are going to do is, I want you to remember that we are going to start working on the strengthening on your lower limbs. And in terms of that, I want you to start working on your gait pattern. This is going to help you to don't have, frequent falls, or hopefully don't have falls at all. Because the foot, your left foot, is dropping, I want you to start working on the muscles that brings your foot up. Does it make sense to you? And for that, this exercise is for that. So you're going to do the heel contact and keep the feet up, keep the foot up, and then go back 10 times. Okay, 10 times with the left, 10 times with the right. Then single leg stance, the right 10 seconds, with the left 10 seconds. Okay?
Okay.
Make sense to you?
Yeah.
Any questions on that?
No.
Alright, and the next thing that I want you to do while you are at home or going out is try to walk as we have learned today. Meaning, try to do a proper heel contact, and remember, not dragging your toe. Probably at the beginning it's going to be hard, but try to do not drag your toe. Try to lift your feet up, all right? And try, if you need to exaggerate the hip flexion, that's fine at the beginning.
Okay.
Make sense to you?
Yeah.
Do you have any questions that you want to add on?
No.
Cool.
Thank you.
Good to see you, Brian. See you next time.